Now the questions that may be asked from this topic in the various competitive exams, they can be either recall type or problem based, that is case based, or image based. Recall type means directly they will ask something related to the disease and you need to answer depending on your memory. And then problem and image based. So we will see some questions of each type and then we'll try to further understand this topic. So starting with the questions now, I think this is the simplest form of question that can be asked from this topic, and it is a simple recall type, that is you need to remember that which type of curve do we get in secretory otitis media in tympanometry. Now in tympanometry there are various types of curves A, AS, AD, B and C, but we know that in secretory otitis media, since there is fluid in the middle ear, so we get type B curve. So the correct answer is B type of curve. So this is a simple question, a recall type of question. Then moving to a next variety, myringotomy is done for all except. So here it is asked that out of these four conditions, which condition does not require myringotomy? Now, acute suppurative otitis media, myringotomy is putting an incision in the tympanic membrane to drain the middle ear fluid or to equilibrate the pressure of the middle ear with that of the surrounding. So first option is acute suppurative otitis media. Here also there is a fluid in the middle ear, and when the tympanic membrane is bulging, sometimes we need to do myringotomy to remove the middle ear fluid. Then secretory otitis media, again there is fluid which can be removed by myringotomy. Aero-otitis media, option third. Now here what happens, because of the rapid descent either in the flight or rapid sea diving, there is rapid change in the atmospheric pressure and the eustachian tube is not able to equilibrate that pressure. So for that, there is creation of negative pressure in the middle ear which leads to the retraction of the tympanic membrane. And in this condition also myringotomy is required so that the pressure becomes normal. Then the fourth option is chronic otitis media. Now chronic otitis media, already there is either a perforation or there is a cholesteatoma. So here we do not need to open the middle ear to drain the fluid. There is no fluid in the middle ear first of all. Secondly, already the tympanic membrane most of the times it is perforated. So the first three are the indications of myringotomy. And the fourth one, that is chronic otitis media, here myringotomy is not required. So the correct answer will be chronic otitis media. Now something regarding myringotomy. As can be seen in this figure, this is the schematic figure of a right tympanic membrane. Here we can see that two types of myringotomy incisions are shown. One is A, other one is B. Now this A incision, it is present in the anterior inferior quadrant and it is radial. So this type of myringotomy incision, it is for secretory otitis media. That is a radial incision present in the anterior inferior quadrant. Another incision we see here is B type. Here we can see that this is circumferential incision and it is in the posterior inferior quadrant. So a circumferential incision in the posterior inferior quadrant is generally given for acute suppurative otitis media. So a question can be framed from this part also, that which type of incision is used in which type of disease. So this needs to be remembered. Further in myringotomy, here we can see that again two types of incisions are given. One is in the anterior superior and other one is in the anterior inferior quadrant. Now when two incisions are put in anterior superior and anterior inferior quadrants, this is called beer can principle. The reason is that sometimes the fluid is very thick which cannot be drained from a single incision. So we put two incisions in the anterior superior and the anterior inferior quadrants. Now one important point to note here is that we see that anterior superior quadrant we can put an incision, anterior inferior we can put an incision, posterior inferior we can put an incision, but we should never put an incision in the posterior superior quadrant. In this quadrant we should never put an myringotomy incision. The reason is that important structures are located medial to it, like the incudiostipital joint, the facial nerve, the oval window. So those structures may be damaged. That is why a myringotomy incision is never put in the posterior superior quadrant. Another question, it can be said as a problem based plus image based combined. So what is it? A 4-year-old child was brought to ENT OPD with complaints of not able to hear properly in school. The otoscopic picture is as shown below. Most probable diagnosis is. Now here from this question we need to uh, see or catch the specific terms. That is, presenting complaint is decreased hearing, and the patient is a school going child. So as I told you that this school word should give us an indication or a hint that this is secretory otitis media. And further, to add to our diagnosis, they have given the figure of the tempering membrane of that patient. So in figure we can see that there is our air bubbles seen, and fluid and air bubbles are seen, and that drum is intact. It means there is fluid medial to the tempering membrane. The patient is a child presenting with decreased hearing. So secretory otitis media, it is the most common cause of decreased hearing in children, and this otoscopic figure is only adding to our diagnosis. So the correct answer here is secretory otitis media. Autosclerosis, it is not a disease for of children. And acute otitis media, in acute otitis media, the picture of the tempering membrane, it's not like that. It is red, congested, bulging tempering membrane generally, which is seen in acute otitis media. The additional symptoms in acute otitis media will be pain and fever. But here the patient is only complaining of decreased hearing. So most probable diagnosis for this question will be secretory otitis media. Moving to a next question. Now this is again an image based question. The question is, identify the procedure. So I have framed this question. So actually these are two questions. So we'll discuss one by one. Identify the procedure for which the instrument shown below is used. So now first we need to identify this instrument. Now this is the tip. This is an instrument of this shape, which is a pointed tip. So this is a Politzer myringotome. As the name suggests, it is used for myringotomy and not for myringoplasty or any other surgery, but myringotomy. So the correct answer is myringotomy. Another way of framing this same question is, identify the disease for which the instrument shown below is used. And then these 3 diseases or 4 diseases may be given. So first again we need to identify that this is a Politzer myringotome. It is used for myringotomy. Then we need to know that what are the indications of myringotomy. So in the previous questions I've already told you that secretory otitis media we require myringotomy, not for otosclerosis or Meniere's disease. These are totally different diseases. So the correct answer for this question will be secretory otitis media. The idea is that we should know that this is a Politzer's myringotome. So such image based questions may also be asked. Another question is, a school going child came to ENT OPD with complaints of fullness of ear. A graph is shown below. What is the choice of treatment? Now 2-3 points to note here is, again as I told you, the patient is a school going child. The complaint is fullness of ear. That is, maybe there is some fluid in the ear or some mass in the ear which is causing fullness in the ear. A graph is shown below. Now here they have not written which graph is this. So first we need to know that which graph is this. Second, we need to interpret this graph. So this here we can see that on x-axis pressure is plotted in decapascal unit. On y-axis milliliter, that is compliance, is plotted. So this is probably a tympanogram, and in tympanogram this black line we can see that it is a flat curve. Here there is no identifiable peak, so this is a flat curve. Now flat curve is seen in type, it is called type B curve. So this is an impedance or a tympanogram showing a type B curve. Now we know that type B curve we get when there is fluid in the middle ear, like in secretory otitis media, and the history also collaborates with it. That is, the patient is a school going child. So the surgical treatment for secretory otitis media is myringotomy. So this patient will require myringotomy. So here they have they are testing our knowledge of tympanogram, so that we should know. So moving to the next question, this is again an image based question. The question says the tube shown below is put in ear for all of the following conditions except. Now here a small tube is shown. So first we need to identify this. So this is a grommet, okay, or also called ventilation tube, also called tympanostomy tube. So when myringotomy is done, sometimes to keep it open for a long time, a grommet is also inserted. So one part of the grommet remains in the middle ear and other part in the external ear, and it provides a channel for the middle ear fluid to drain out into the external ear. So this is called ventilation tube. Different types of grommets are available: Shah grommet, Shepherd grommet. But in this particular question, it says that this grommet is used in all of the following conditions except. So first is autosclerosis. Now autosclerosis is a disease where there is fixation of the stapes foot plate. So there is no middle ear fluid to drain. So grommet is not used for this autosclerosis. Other options, aero-otitis media. Yes, because in aero-otitis media, sometimes to keep the myringotomy incision open for a long time, because the pressure in the middle ear is negative, to equilibrate that pressure, we need to insert the grommet sometimes. And in serous otitis media also, to continuously drain the fluid, we need sometimes grommet insertion with myringotomy. So out of these three options, autosclerosis is a condition where this tube, that is ventilation tube, is not used. Now in this question, all of the following are true for secretory otitis media except immediate myringotomy is required. So myringotomy is the surgical management for secretory otitis media, but the uh, medical management should be continued for at least 3 months before going for surgical intervention. So immediate myringotomy is not required. Initial there is medical management, and then we can plan myringotomy if the medical management fails. So this is incorrect. Let's see the other options. Type T tympanogram, this is correct. Middle ear effusion is sterile. Yes, most of the time it is sterile. And most common cause of deafness in children. Yes, we know that secretory otitis media is the most common cause of mild conductive deafness in children. So the second, third, and fourth options are correct. So the only incorrect option here is immediate myringotomy is required. Immediate myringotomy is not required. It is required after the medical management fails. Now another case-based, or we can say problem-based question is shown here. A child was diagnosed with acute otitis media. After 14 days of antibiotics treatment, there was subsidence of pain, but persistent of deafness. The probable diagnosis is. Now, we should know one thing, that one of the etiologies of secretory otitis media is incompletely resolved acute otitis media. So whenever a child has an attack of acute otitis media and antibiotics are given, sometimes the infection goes away. So all the signs of the infection, that is pain, fever, they go away. But the fluid remains in the middle ear, and that fluid becomes sterile, but it is a cause of deafness. So this child probably has developed now sterile fluid in the middle ear, that is secretory otitis media. Let's see the options. Ototoxicity. 14 days of antibiotics, generally it won't cause ototoxicity, because antibiotics are generally, aminoglycosides are ototoxic, but they are not given as a first line drug for acute otitis media orally. So this option is ruled out. Secretory otitis media, most likely this is the correct answer, as after 14 days of antibiotic treatment the infection is gone but the fluid is there. So a sterile fluid in the middle ear is secretory otitis media. Then tympanosclerosis. Again, in tympanosclerosis, there needs to be some injury over the tympanic membrane, which heals as a sclerosis. In autosclerosis, again, there is no fluid in the middle ear. So, out of these four options, the most probably the correct answer will be secretory otitis media. And here we can see that the age of the patient, that is a child, it matches with our diagnosis. Autosclerosis is not seen in children. So, secretory otitis media is the correct answer here. Another question. A 70 years old male patient with right side, he presented with a right side hearing loss. On otoscopic examination, there was a dull tympanic membrane. Audiogram showed conductive loss, and tympanogram showed type B curve. He also has enlarged nodes in the right posterior triangle. So what is the most probable diagnosis out of these four? Now here, when we see the age of the patient, we know that we have been talking about secretory otitis media as a very common pathology in children. But here this question I have specifically put to make you understand that sometimes the secretory otitis media is also seen in adults, though the cause may be totally different from that of children. We'll see. So this is a 70-year-old male patient, right side hearing loss, dull tympanic membrane, conductive type, type B. So up till this line we can make a clinical diagnosis that this patient is having a right side serous otitis media. Now one important point here is that generally in adults, the serous otitis media, if it is unilateral, then we should suspect some mass in the nasopharynx. And in children, generally secretory otitis media is a bilateral condition. Now here one more detail is given that he has enlarged lymph nodes in the right posterior triangle. So what is the most probable diagnosis? So for we'll go one by one. So the first option is middle ear tumor. It can cause conductive loss, dull tympanic membrane, and everything except that it is not a very common cause for right posterior triangle. Nasopharyngeal malignancy. This fits into our diagnosis because the patient might be having some malignant mass in the nasopharynx, which is the cause for development of the secretory otitis media and also the metastasis of the lymph nodes in the posterior triangle. Then acoustic neuroma, again generally there is no lymphatic metastasis, and even the age of the patient does not match with acoustic neuroma. Tuberculosis of the middle ear. Tuberculosis generally present as discharging ear or a pale granulations are present. The tympanic membrane is most of the times not intact, and multiple matted lymph nodes are present in tuberculosis. So out of these four, the most probable diagnosis which fits into this history should be nasopharyngeal malignancy. So the point important here is that in children, the adenoids, enlarged adenoids or tonsils may be the cause of secretory otitis media. But if an adult or an elderly individual develops a secretory otitis media, then we should always suspect some malignant mass in the nasopharynx. So thank you very much for your patient listening, and I have tried to cover most of the important aspects of secretory otitis media, giving an example of different types of questions. And if you have any queries, then please put them in the comment box. I'll try to address each and every one. Thank you very much.